Good day, and welcome to the Kansas Walk with a Doc Opportunity informational webinar. Today is December 10th, and we will be presenting on the opportunities that have become available with Walk with a Doc. I'd like to now, before we get started, I'd like to do a few housekeeping items. Today's webinar is being recorded, and a link will be made available to you shortly after today's webinar to share with those in your facility who were unable to participate. Also, you should be seeing a set of PowerPoint slides in the middle of your screen. There's nothing you need to do individually to advance those. We will take care of that for you. At the end of today's presentation, we will have an opportunity for you to ask questions. You can use the chat feature, which is located on the left-hand side, or the Q&A feature, which is also located on the left-hand side, to submit questions to the presenters, and those will be answered as soon as possible. I'd like to now turn today's call over to Karen Bremen with the Kansas Hospital Association to introduce our speakers. Karen, please go ahead.
Thank you, Haley. Good afternoon, everyone. Thank you so much for taking time out of your day to join us and talk to us about a really exciting opportunity that we are very pleased to partner with the Blue Cross and Blue Shield of Kansas Blue Health Initiatives and Walk with the Doc program to offer KHA members. And this is, and as Haley mentioned, an exclusive sponsored opportunity that will be available this spring to our members. This really came about in a conversation that KHA had with Virginia about how to support our communities and our hospitals in the communities with a program that would inspire movement and conversation. And the Walk with the Doc program is the perfect way to do that. So both Virginia Barnes, who is the Director for Blue Health Initiatives, she's been in that role for about 5 years. Prior to joining Blue Cross Blue Shield of Kansas, Virginia was with the Kansas Department of Health and Environment as their Community Clinical Linkages Director. So Virginia's joined us and will be speaking for a few moments about what has inspired Blue Health Initiative to pursue the Walk with the Doc opportunity. And then following Virginia, Rachael Habash, who is the Chief Operating Officer with Walk with the Doc, will talk about the program and resources that will be available to our members who decide to start Walk with the Doc chapters in your communities. Rachael, during her time with Walk with the Doc, she has grown the program from 112 communities to over 550 communities in 47 states and 34 countries. So without further ado, I am going to turn it over to Virginia Barnes, Director for Blue Health Initiatives. Virginia.
Thank you, Karen. So I will just be providing some information on why Blue Cross and Blue Shield of Kansas has made this investment and created this partnership with the Kansas Hospital Association and Walk with the Doc. This is a part of our Blue Health Initiatives that was started in 2016. And Blue Health Initiatives supports our overall mission as a company to be the insurer that Kansans trust with their health. And of course, health is something that we think about across the lifespan. And so Blue Health Initiatives was this opportunity for us to really invest in communities to create those sustainable, healthy places where Kansans live, work, and play to improve their quality of life. So looking at community health and population health and how we can really invest in improving long-term health outcomes. And so the Blue Health Initiatives area that this Walk with the Doc partnership will fit under is our healthy lifestyles. We have several areas that we work with. Our Pathways area covers large community health initiatives and really focuses on how we can connect through community coalitions to improve health. And our Trailblazers activity focus more on innovation and new and creative ways to think about how we can impact the social determinants of health. But we really felt that just still having that focus on healthy lifestyles was important too, and being able to partner with another statewide partner such as the Kansas Hospital Association and really cover our full service area with these opportunities that connect healthcare with their communities, this fit just so perfectly that we were very excited for the opportunity. So I won't spend any more time talking about Cross Blue Shield of Kansas's piece of this. I will get to the fun part and turn it over to Rachel. So thank you.
Thanks, Virginia. The pressure is on. I need to make it fun. Okay, I will certainly do my best. If we were together, I would pause for a moment and encourage everyone to engage in any sort of movement of your choice. I will encourage you to do that now as I get through this intro slide. It's so important for us to be getting away from our desk and moving. You all know that probably better than I do. So any opportunity we can sneak that in there, I try to do so. It is an honor to be with everyone here today to share the Walk with a Doc program and the resources that we provide. We would love to get your communities engaged, and we promise to make it as simple as possible to do so. Today I'm going to give you an overview of what Walk with a Doc is. I'm going to take you through a typical event. We will talk through the benefits for both the participants and the healthcare providing leaders. I will go through the steps for getting started and all of the resources that we will provide your team in order to implement within your community. Our founder, Dr. David Sabger, is a cardiologist, and when he came out of his fellowship, he was equipped with the knowledge and what he thought was an inspiring message to get people out and moving, to mitigate symptoms they were presenting with and encouraging people to live healthier lifestyles. What he found shortly after his fellowship is that despite his best efforts, people weren't moving, even though he would encourage them to do so. He learned really quickly that he could not spend his career telling people to move and not having them heed that wisdom. So he wanted to do something more. So he decided he would meet his patients in the park. He's like, this is so important. I will meet you there. I'm going to grab my family. You grab yours. Let's go to the park on Saturday morning and let's walk together. You can imagine how some patients met that call to action. Here's a physician giving his time, being willing to meet in the park and saying, you really are that important. This is that important to me as your doctor. I want to walk with you. And from that, Walk with a Doc was born. David never had any aspirations to grow this throughout the world, but what he quickly learned is that the benefits are far-reaching, both for him as a practitioner and for our community. And when other practitioners started hearing about it, we just started to expand. That leads me to information that Karen provided earlier. We are in over 530 chapters in 47 states and 34 countries. When I define a chapter, what I mean by that is a community that is leading walks on a regular basis. So to be defined as a Walk with a Doc chapter, you have to commit to at least one walk a month. Some of our chapters are gathering twice a month and some of them weekly, caveat being in normal times, not during COVID times, but we'll get to that in a little bit. So I mentioned that David started this walk because he wanted his patients to move, but it's morphed into so much more than that. The impetus was physical activity, but at every walk, we provide education as well. So there's a 5 to 8 minute health talk at the onset of the event, any relevant topic, of the provider's choice. We also provide talking points too if a physician doesn't, have anything readily available that they want to talk about, or maybe they've exhausted all of their topics for the time being. We try to spend time outside in nature. There are health benefits for that as well. And then the true secret ingredient is that social connection. It's so important, and I think we see that more now than ever with COVID and the social isolation that we're facing, that people are connecting and that we're giving them an opportunity to do that. The social connection piece initially was an opportunity to humanize the healthcare experience. So the physician was no longer, a doctor, an expert wearing a white coat, handing out presumably, potentially scary news or, the white coat syndrome. They no longer were that person. They were a human being in baseball cap and sneakers with a family. And likewise, the patient was no longer a set of symptoms, but that you had to solve or work through in 7 to 10 minutes in an office visit, but rather became a human being as well, who was at the park with you and brought their dog and you were learning about them. So there's a humanization piece of it. But that social connection, again, extends beyond what's happening with just the healthcare providers and the patients to include the connections that are happening amongst walkers as well. I'm going to spend a couple minutes and take you through a typical walk. This picture was taken pre-COVID. Most of the pictures you see in here today are pre-COVID. Otherwise, you'd see people masked up and spaced apart quite a bit. So again, as I mentioned, when you commit to bringing Walk with a Doc to your community, you commit to at least one walk a month. Certainly you can walk more than that, and we would love that, but we only ask at a minimum that it's once a month. At the onset of the event, a healthcare provider will talk for, again, 5 to 7 minutes on a health topic of your choice. And that healthcare provider can be a physician, nurse practitioner, physician assistant, physical therapist. It can be any healthcare provider that is interfacing with patients. After the 5 to 7 minute talk, there'll be an opportunity for a couple of questions and answers. I want to emphasize that this education is health education. We are not dispensing medical advice at our walks ever. You inevitably will encounter someone who might ask for medical advice, and we just encourage our leaders to employ whatever tactics they might employ if they are approached in the grocery store, where they deflect and point people back to the office for a medical consult. This is not the place for that. There's certainly an opportunity to ask general questions, but it's not for medical advice. The remainder of the hour, everybody walks, and we don't walk in a big gaggle. We partner up with 1 or 2 other people, and we aim to have participants elevate their heart rate. So we all have varying different abilities and capabilities, and so we want everyone to get at least 30 minutes of physical activity while they're with us at Walk with the Doc. So again, it's encouraging small groups. Healthcare providers and other people of your team can kind of bounce around from group to group. It helps if you have a circular path so that you can easily do that. And again, it provides an opportunity for that, an added layer of intimacy and connection. This last block, I just want to emphasize what I just said was the bare bones. So again, we're meeting on a regular basis, and we want this program to be sustainable for you. So if we start offering breakfast spreads and a lot of bells and whistles, it quickly becomes unsustainable. So everything I say now is optional. You certainly can do it. Blood pressure checks are great. Those are pretty easy, a great add-on. You will receive incentives in your kickoff material, so those are great to use as well. Offering health screenings can be a little more laborious, but we encourage you to maybe do that at the onset or maybe as a 1-year anniversary celebration. Healthy snacks and drinks are always great to have if it's within your budget and your management needs. I also want to emphasize here that participation for our events for the walkers is always free. And so we always ask that when if you partner with a local fitness club or a local grocery store or whomever you might partner with to make this walk possible, we think that's great. And sometimes, people will want to give away free items. We just ask that you never sell anything at your event. We don't want to impose upon people. We want to make sure that they feel comfortable coming and don't feel asked to buy anything or pay in any way. I'm going to transition into the benefits for a moment. I've talked a little bit about this provider-patient relationship, but I'll go up to the community recognition and trust piece as well. I will say this about our founder. So he's a cardiologist. I would say that 10% of the walkers at his event are patients. Initially, that's how they hear about the walk. But whenever anyone at an event has a need for a cardiologist or has a friend or a family member who has a need for a cardiologist, David is their guy because he has established that kind of community, trust. They know him on a more personal level, and that's who they want to get their care from should a need arise down the road. I also want to talk about burnout. Physicians, obviously, this is an added demand on your time. It could be an hour a month. But David impresses upon people that he speaks to that you get so much more out of it. It's an hour very well spent. It's an hour that that you're saving on, right? Like so maybe you only have 7 minutes in the office with Amar, but you're going to see him on Saturday morning. And so it's really helpful at mitigating some of the burnout symptoms that you're faced with. I'm not going to read through all of these. I mentioned the walker to patient conversion with David. There are a lot of benefits that our physicians and our hospitals are reaping the benefits from. So we're going to jump into getting started. At a bare bones, what you need is a walk champion. And so the walk champion does not have to be the provider per se. So it can be anyone. It can be someone on your leadership team. It could be someone in marketing. It could be a practice administrator. You just need someone who's going to oversee the program. You also need to identify a safe and accessible walk location. So we really encourage an ADA accessible location. That's not always possible. We can certainly help and lean on some of our partners to help identify a safe place for you to walk in your community. Again, we ask that you commit to 1 walk a month. And then you'll need healthcare providers, to be there at the walk, and so organizing that piece of it. And then activating our marketing materials. So I'm going to go into detail what we provide to help make this walk possible. We just ask that we provide everything short of putting it in place. And so all of the materials we have available, we just ask that you put them into your marketing channels to spread awareness for the event. When this PowerPoint will be sent out to you, and so I encourage you to click on this link here for our housekeeping items. I'm going to talk through them briefly. KHA is going to have a commitment form for anyone who's interested in participating through this grant. It'll be a brief commitment form for you to complete. At that point in time, we will send you some of our paperwork. So there is a marketing and licensing agreement that outlines the parameters of our walk and logo usage, typical things that you would see in a licensing agreement. It's a very flexible document, so we can work with your legal team on that. And then we have also a brief application, which will simply ask, who is going to be your team lead, who's your physician, contact information, where you'll be walking, and when you'll be walking. Thanks again to the grant that is being funded by Blue Cross Blue Shield, and with this initiative with KHA, you guys will be provided with the following resources. You will be receiving what we refer to as our starter toolkit. In our starter toolkit, you will receive general liability insurance. So you don't have to worry about absorbing any sort of risk. It is general liability insurance. It's not malpractice. I just want to emphasize again that we are not dispensing medical advice at these events. The general liability covers anyone participating, healthcare providers, community members, volunteers. If anything should happen, knock on wood, with, falling or any incidents at the walk, we would activate insurance through our channels, and you don't have to worry about that potential headache. We also will, for all of our chapters, we develop a web page. With the information we gather on your application, we will build a web page for you on our website. What we do there is anyone who learns about Walk with a Doc who might want to participate, can use a zip code feature finding tool, type in their zip code and see if there's a walk near them. That will drive them to your page that will have your information about your events. It's your space on our site, so you can put pictures of your providers, of your logos of your hospital. It's your space to use however you want. We also will provide you with a starter set of Walk with a Doc t-shirts. They will have the branding that is listed there on the slide with the partners' logos on it. You also will receive some other sample incentives, a pedometer, a car magnet, I believe a water bottle as well. We have also best practices we'll share with you, waivers for that liability insurance, a lot of marketing material. I'm going to go through that in detail in a little bit, so I'll save that for later. And then we also will officially welcome you through our newsletter channel. Once you complete the paperwork that I mentioned earlier, we will start what we call our funboarding process. You will receive in the mail that starter kit that I just walked through, but you also will get a digital welcome. The digital welcome will provide you with next steps for planning and getting prepared for your event. You will receive your certificate of insurance, access to all of our marketing resources. We will, to include examples for social media posts to let your community know what's coming. We also will provide you the keys to the kingdom. We will provide you login and password for our leader portal, which I'm going to go through in detail here in a little bit. I mentioned this, our web page, and this is just the search feature that people can use. So we are fortunate in that we get a lot of national attention, and so there could be people within your community who hear about it through, for example, we were a CNN hero a couple years back, and they might want to know if they have a walk in their community. We were in the AARP bulletin, so people might find out about Walk with a Doc in general from national press, and they can come here and they can search by zip code or city to find your walk location. All right, leader portal. I am going to share my screen, and Haley is going to tell me when you guys can officially see it. And as we transition, I'm going to start talking you through our leader portal. Hang tight for just 1 second. You guys are still there, right?
I am, yeah. I'm just waiting. I don't see...
I was just kidding. I assumed you were.
Oh, okay. Yeah. I always get a little nervous from the technical side when it's mute or silent. Rachel, did you click that button to share my screen?
Oh, I'm sorry. I did. Maybe it hasn't been, you know what, I only clicked one of them. That is totally my fault. You warned me about that too.
Hey, you're okay. We'll just give it one more second, everyone. We love technology when it works, so our fingers are crossed. Rachel, I can see it on my side as a technology person, but I'm waiting to see it on the attendee side.
This might be a good time for a joke. Do you have one, Haley?
You know, I really don't. I'm not a dad. I'm a mom, so I don't have any good dad jokes. I guess that's my only joke. Let's Can somebody from KJ staff who's listening to this webinar put in the chat if you're seeing it on your side? I don't know why we wouldn't be seeing it. Not seeing it from Cindy Samuelson. Thank you, Cindy. Let's go ahead, Rachel, and stop share.
Okay.
If you'll hit stop share, we're going to try and hit OK. We're going to try one more time.
Okay.
Okay. So if you hit share my screen and then hit that second button to, like you did. Rachel, what are you seeing on your side?
It looks like things are frozen over here. That's unfun. Are you guys still there? You're still there. I wasn't joking this time. Time because my whole screen shut down.
Oh no. Okay.
It's okay. It's back up now. Let me just try one more time. I apologize, everyone. This would be a great time to, again, move. Good opportunity for that as I fumble my way through. We're going to get there. I'm confident of it. I think everything looks right on my end. It says it's sharing. We're probably just on a little bit of a delay at the moment. So I'm
Rachel,
hopeful.
do you have a button that says broadcast screen share to audience?
Yes, I do.
All right, and we are live, so we're good. If you're hearing
fantastic.
audio through your computer, you may need to mute.
Okay. You guys,
all right,
everybody can see this now? Okay, wonderful.
Yes.
Thanks,
and
Haley.
just remember there is a slight delay from you talking to the computer just to make sure of that.
Okay, great. Thank you. Welcome to our leader portal. So as I mentioned, there'll be a lot of resources that live here for you. Everything from those best practices to marketing tools. So I just want to click through and take you to a couple of the pages. We will spend ample time getting you ready for your first event. This isn't rocket science, and I feel like when I talk about this, I talk about it ad nauseum, and I make it sound more complicated than it is. That's not my intent. My intent is to let you know you are supported fully. You have all of the resources you possibly need to be successful, and perhaps it's a little overkill, but it's all there for you. If you're thinking about it, chances are good we have it. So again, we'll spend some time ramping up for your debut, working with you, showing you what we have, giving you access to this leader portal. And when you're getting ready for your first event, we have a lot of walk day materials here for you. So waivers, sign-up sheets, ways that you can track attendance if you choose to do so, welcome flyers for your walkers, which is in my PowerPoint. I'll show you that to you in a little more detail. It's all there. You just need to be there with your healthcare professional to make the event fun and what it will be. I'm going to click over to the marketing tips and tools. I know you guys are a little bit behind on the screen here, but I just want to show you a couple things. We have an entire marketing guide which will break it down for you by week. So if you're 6 weeks out from your event, it will tell you things you need to be thinking about all the way to the day of the event. Again, it's not that hard, but all of the material is there if you choose to interact with it. Some examples of marketing material. We have a ready-made press release for you where you can insert your hospital and a quote from your CEO. All of that material is there. You just need to get it out to your press contacts. We also have, I'm going to scroll down a little bit and hope that you guys catch up here with me. We also will have sample presentations for you to share with different stakeholders. We have prescription pads. So these prescriptions will be used with your healthcare providers for them to hand out. They're ready-made. You just need to add your date and the location in which you're walking, and it's a simple invitation from your physicians, again, for them to be handing out in the doctor's office. So the material is there, it's available, it's just a matter of putting it into place. Everything from flyers, posters, again, the prescription pads, radio spots, it's all created, it just needs to be put into place and activated. I'm going to scroll back up a little bit, and I'm going to click onto, I'm going to skip the logos and flyers, pretty self-explanatory, and I'm going to skip to social media. So there are a lot of channels, there's a lot of way to get the words out. No reason for you to have to rethink this collateral. I'm sure you all have great marketing teams and they can do this arguably better than we can. But in the event that your team doesn't want to spend time spinning their wheels, ready-made posts are available for you, including pictures, shareable images, so you don't have to reinvent that wheel. I am clicking on health topics. So I mentioned before that your physicians or healthcare providers can talk about whatever health topic that they choose. Obviously, COVID has a lot of buzz right now. The vaccine would be something timely. Talking about the flu vaccine, walking in warm weather, cold weather, all of that stuff. Those are all great topics. And it probably depends on your provider who's giving the talk. But if your provider is leading his 400th walk and he's like, I just don't know what to talk about, he or she can come here to this page and tease off some one-pagers that they might want to use. And then in the event that you're looking for any of your material in Spanish, that is available there for you as well. This leader page and hopefully smoothly navigate us back to the presentation.
Yep, and we are back on the presentation.
Perfect, thank you. So as I mentioned, we are going to help you through the ramp up. Hopefully you don't get sick of hearing from us. We will be sending you weekly communication after you become an official walk chapter. So as I mentioned, you'll get that digital welcome, and then we're going to send you marketing material chunked down. So 1 week we'll talk about our overall strategy for Walk with the Doc. The second week we'll focus in on flyers and posters. The third week we'll hone in on the social media. So that material is there for you, again, to interact with, and it's chunked down in a way that you're not overwhelmed by this large presentation for all the tools that are available for you. I mentioned this when we were in the leader portal. We have a flyer that you can hand out at your first walk, just explaining to participants what Walk with the Doc is, what happens during a walk, why we're here. We have on our website a list of 100 reasons to walk. That is a resource that community members really value. So we put it in here so they can access it early on as they're interacting with you guys. We also have information there for them to interact with our social media and sign up for our newsletter. If you aren't on our newsletter, I encourage you to go to our website, walkwiththedoc.org, and sign up. We are providing health information in a way that we're trying to inspire and be a little different. So it's not, it's funny, it's off the beaten path, and the hope is really just to inspire conversation and movement. At least you think you're done with us after your first walk. I'm sorry, we'll still be there to help you along the way. We will check in with you after your first walk, and we will provide some tips for what you can be thinking about. Again, I think that we have created this way of communication so that we can chunk it down for you, but also so you don't have to remember everything. It's just, easy reminders. Leading up to your walk, a week out, here's what you need to be thinking about. Right after your walk, here's how you can capitalize on your momentum, or how you can interact with your walkers going on from here, what to do with the pictures or the emails that were provided for you. Again, all of those best practices will be provided for you at the right time. We also communicate with our leaders monthly. So let me digress for a second. So you sign up, we welcome you through an electric or digital welcome. We send you something in the mail, and then we're there and we're pinging you with information weekly. You have your first walk event, we check in, we see how everything went. From there, we are not we're not holding your hand as much, or we're not in your inbox as much as we were prior to your first event. But we do communicate with our leaders monthly, and so these are just some samples of what monthly communication will look like. That last Avo Walk with the Doc, we had an opportunity with Fresh Avocados Love One Today last year where we partner with them, and so we will just share that kind of information with you. Okay, I promise I'm almost done. I wanted to spend a little bit of time talking about the elephant in the room, COVID. We were going to launch this initiative, I feel like a year ago, and then COVID had other plans for us. And so they not only had other plans for us in Kansas, but also nationwide and internationally. So we have pivoted to virtual offerings while we have to offer them virtually. So we have some communities that are able to safely gather and connect outside, masked, 6 feet apart, where there aren't spikes. They're able to do that. Most of our chapters cannot. So we offer virtual programming every Saturday. Again, if you go to our website, you can sign up for a virtual event. While we are navigating this time of COVID and still trying to figure that out, any walk chapter that wants to be featured on our channels for these virtual Walk with the Docs, they absolutely can. So if you sign up to bring Walk with the Doc to your community and you have a doctor that you want to be featured on our virtual channels, we're happy to connect with you and go over those details. Over here on the right-hand side, you'll see this kudos to Trish for a Trailblazer Challenge. We spent some time in the last couple months working through how can we really augment our virtual events. So as I mentioned early on in the presentation, Walk with the Doc isn't just about the walking. There's so much more to it. And so when we offer these virtual events on Saturdays, we are encouraging movement. We can't guarantee that people are doing it. What we do know is if you're watching, you're getting health information. That health information is one of 4 things that we want you to achieve when you're at Walk with the Doc. The most critical thing that we want for you is social connection. So we piloted a program called our Trailblazer Challenge, where we created a Facebook community, and we were a little more involved with the participants. So we were encouraging them with health challenges. We were encouraging movement every day, or at least 5 days a week. We were giving them an opportunity to connect with one another. That's a little bit of a taste of what that was. We hope to have that package and available for all of our Walk with the Doc chapters so that they can implement it in their communities during times of COVID when we can't meet together, and also to augment their chapters as well. Unfortunately, I don't think that you guys can see this slide, but when the slides are sent out to you, there will be a video embedded here. I wanted to spend a little time talking about another virtual opportunity. We are just coming off our first virtual walk challenge. We had 500 people participate in a walk challenge where we virtually climbed Mount Kilimanjaro. It was 44 miles, 2 weeks, opportunities to connect on a digital platform. It was incredibly rewarding. We activated people to move. We encouraged people to move more than they already were, and we really touched on that social connection in a meaningful way. Throughout the challenge, we offered base camp videos that were led by our healthcare professionals. They were held every day, so health information was being dispensed. Again, as I mentioned, it was incredibly successful, so we will look to mimic that I mentioned that we provide monthly communication to our walk leaders. We will provide that information in our communication to you. We did have some walk leaders who were activated to share the information with their walkers and get their communities engaged. It's just another opportunity in this time when we can't meet together to encourage your patients and your employees, to connect and to move. There's the video. I can't play it, but there it is. If I haven't emphasized enough, I'm sorry, I've talked so much, but we are here. We want you to be successful. We exist because of altruistic people like you who are willing to engage in your community, and we want to make those efforts as easy as possible for you. So with that, I will pause. I believe I'm handing it back to Haley, and I'm happy to answer any questions that anyone might have.
Yes. Thank you, Rachel, for that presentation. I chuckled a little bit when you said it's been a year since we were going to implement this, and we've been actually talking for a lot longer than that. You are so right. We had no idea COVID was going to hit, and we had plans to implement this a year ago. So I wanted to take a moment from the Kansas Hospital Association perspective, and just thank Virginia and thank Rachel for bringing this opportunity to light and to start getting this going. We do already have a couple of Kansas hospitals who have shared some of their best practices and what they're doing at their facility. And, I'm happy to connect you if you want some boots on the ground examples from those hospitals. Reach out to myself, Haley Finch at the Kansas Hospital Association, and I can get you in contact with those hospitals and what they're doing to have successful Walk with the Doc programs at their facilities. I want to also say from Karen and I's perspective, as much as Rachel said she's going to be communicating with you, we also at KHA have some opportunities that we're going to make sure we're communicating with you and making sure that these programs are successful at your facility and there to support you. I do want to say that if you have any questions or you're thinking about or you want to talk about, don't hesitate to put those in the Q&A. I don't see any at this point. One question that came through my email is that somebody asked, what does sponsored by Blue Cross Blue Shield of Kansas really mean? And I know that Rachel kind of hinted at what you get when you sign up and sign the agreement to work, which is the starter toolkit. You do get that assistance from Walk with the Doc, KHA, and support for 1 year. So they are really, Blue Cross Blue Shield of Kansas is being really generous and is going to sponsor a hospital for 1 year. Virginia, I don't know if you have anything else to add to that or any comments on that.
Yeah, thank you. So what we have done is covered the cost of being affiliated with Walk with the Doc because we do think it's important. Sometimes those upfront costs are a barrier for folks to get started, and we don't want that to be a barrier for you. And so that's what we're covering.
Great. Thank you, Virginia. All right. Any other questions? I know another question that has come in, and Rachel, you can answer this, is, sometimes providers are limited. I think you may have actually mentioned this, but you could just make sure to re-emphasize it, is sometimes providers are limited. What other opportunities of who can do the walk as a walk leader?
Sure, happy to answer that. So you're looking at 1 hour a month. It does not have to be the same healthcare provider every time. So you can have a physician, board-certified physician, a resident physician, nurse practitioner, PA. There are ample opportunities there to divide and conquer.
Great. Thank you, Rachel. I don't see
And
any other
Rachel,
questions.
if I could, yeah, sorry, Haley, if I could just add too, and this is something that we've talked about before and received questions from our members about. Rachel, while the name of the program, is Walk with a Doc, I mean, really there are lots of different types of providers or leaders within a hospital or member organization that could lead the walk. So anything else you want to add there? We've heard stories about dietitians providing an update on nutrition before a walk, and other provider types. Anything else you want to add there?
Yeah, so I would just say that, so we have a couple of different programs. We have a Just Walk program where it's any licensed healthcare professional can lead the walk. And then what we're talking about here with Walk with a Doc, expands it from, or limits it a little from the any licensed healthcare professional to physicians, nurse practitioners, PAs, but anyone with that doctorate level of medical education can lead. The caveat being, if you have a physical therapist who doesn't have who is an advanced degree physical therapist who's going to lead your February walk, that's totally fine and acceptable, right? Like every healthcare provider has important information to share. We don't want to limit. I just caution that as the program that's implementing or the hospital that might be implementing, your community is going to expect a physician of some sort there. The name is in the title, right? Walk with a Doc. And so we've just experienced that in communities where we'll have what we call it Walk with a Doc, and maybe they have, I don't know, a speech therapist who's there every week, and they're like, where's the doctor, right? I want to caution you that you're communicating clearly. So if it's Walk with a Doc, and this week you have dietitian X, and next month you have physical therapist John Smith,
right?
Whatever the case is, just clearly communicate so that you don't get any sort of pushback from the community. I hope that helps.
Yeah,
I don't mean complicated. I just want to make sure. Yeah.
Right. Thank you, Rachel. And I suppose, the point we're trying to make with our members is that it doesn't have to be a provider. As we know, in many communities, there may be a very small number of physicians, but we really encourage other clinicians and leaders from within the hospital to lead the walks as well. Thanks, Rachel.
All right. I don't think I see any other questions coming in the queue. I just want to again thank Rachel and Virginia and Karen and Cindy Samuelson, who's also on the call, for putting this together. We're really passionate about this and really excited that it's getting off the ground, even with COVID still on the table. Question did come in. That's a really good question. How long is the initial commitment? And Blue Cross Blue Shield essentially covers the cost for the first commitment. What is the cost if we wish to continue after the initial commitment? So the initial commitment is 1 year. Rachel, correct me if I'm wrong there. And then if you'll answer, what is the cost to continue the commitment?
Yep, sure. So bear with me. So you'll have your first year is covered. It's free. And you actually will have until, if someone signed up today, they will have until May of 2022 until we would ask for another financial commitment for them. It's $250 to renew. If it's a barrier in any way, we will work with you through that. We never want to lose an active walk because of $250. We can certainly work through that. But the reason I stumbled a little bit there is because our renewal season is always in May. Your first renewal, we don't ask anything of you. And so I guess I gave you the wrong date, right? We are in 2020. So it would be 2023 before you would owe anything, right? So KHA covers you through May of 2022. Your first renewal, we don't ever ask anything of you. So you're covered until May of 2023, which is when it would be $250.
So Rachel, just to clarify, is that a 2-year commitment or a 1-year commitment?
It's a 1-year commitment. We just don't, it's just our practice to not charge anyone after their first year.
Okay.
I know that's confusing. It's just our, sorry, go ahead.
No, go ahead. Sorry, Rachel.
It's your commitment. It is a 1-year commitment. We just handle our renewal paperwork in May. I'm sorry, it seems very confusing and I'm not communicating very clearly.
No problem at all. I think the answer is, though, it is a very nominal fee of that $250 to continue on after what Blue Cross Blue Shield is sponsoring.
Right.
Oh, another good question. Is there an exclusivity if two hospitals want to participate in the same market? Karen from KHA, or I think the answer is no, but I want to make sure that Karen is still on.
Yeah, I want to make sure I understand the question. Could you repeat that, Haley?
Yes. So is there an exclusivity if two hospitals want to participate from the same market?
Well, and this gets into what the definition is of a chapter, and what they mean by market. But as long as the hospital is setting up their own, or the member organization is setting up their own chapter within their community, they could do so. I don't see a problem with that. But Rachael or Virginia, you could chime in on and elaborate on the definition of chapter if that's not correct.
Sure, I'm happy to do so. So we define chapter by a single physical location that is being served. So you pick Dodge Park and you meet there on the first Saturday of the month at 9 a.m. That's your chapter at Dodge Park. I realize that your hospital will serve many more areas than just that location, but that is your chapter, Dodge Park. And we, because our mission is to activate communities and to get people moving and inspire conversation, we do not get into exclusivity. We try to operate more of a Switzerland. But I totally understand the question, and I understand why that might be desirable for some. And so what we do, if there is a second hospital within the same community who says, I want to walk at Dodge Park, we will make sure everybody is connected and that we're not competing with one another, but augmenting each other's efforts. So if both of you choose Dodge Park and, it's your service area, you're not both going to be walking at Dodge Park on the first Saturday at 9 a.m. We just work together so that you guys are, again, supplementing each other's efforts. I know that probably doesn't bode well by way of the competition that might be in place. We as an organization do not facilitate or offer any sort of exclusivity. I hope that helps and answer the question.
Yeah, so I think the answer is that would not be an issue. It really is the hospital or the member, setting up their own chapter, and there could be more than one chapter in a community, is what I'm hearing.
Yes, absolutely.
Perfect. Thank you. One other thing I just want to clarify is, KHA really does envisioning this launching in the spring, but as we were discussing earlier today, just as a KHA team, early spring is just really right around the corner. And so Rachael mentioned having that 4 to 6 week buffer before your first walk would be to really get engaged and get that planning going. And so prior to that, if you're backing up on the calendar even further, really getting that next steps would be getting that agreement letter signed, reviewed and then signed, and then working with your team internally to start planning on who's going to coordinate this effort. And then by that point, you're really looking at that February timeframe, and then your 4 to 6 weeks to start working with Walk with a Doc on launching this at your facility and in your community. So I know that December right now, everybody's in the weeds of COVID and holidays and everything else, but I do think taking the opportunity to really to start planning now for the spring will make these really successful. And again, we are, here at KHA to help support you and get you connected with best practices here in Kansas and answer any questions you may have following today's webinar. Again, next steps, I will be sending out the recording to today's webinar, and also we will be sending out that agreement letter from KHA to get you engaged with Walk with the Doc. I do want to just check in with Rachael, Karen, and Virginia to see if there's any last-minute comments before I close out today's webinar.
I would just like to thank again Virginia Barnes and Blue Health Initiatives for their generous grant to sponsor this Walk with the Doc initiative for KJ members, and thank Rachael and Walk with the Doc for their partnership and you all for participating.
Great. Virginia, any last minute comments?
Yeah, I would just say, again, we do know that physical activity, social connection, and being able to reduce stress are all very important, especially now. And so we think this is a really great opportunity and partnership. We're really pleased to be able to do the partnership with Walk with the Doc and Kansas Hospital Association. And we look forward to engaging with you as you join us. So thank you.
Perfect. Well, thank you, everyone. There's nothing you need to do individually to close today's webinar out, but hang up your phone line and close your web browser. Thank you and have a wonderful afternoon, everyone. Goodbye.